Good morning all. Today we are going to see about immediate basic care of newborn. So here I wish to say what is the care we have to given for the newborns immediately they were after the birth. So as here a majority of the babies are cried at birth and it takes spontaneous respiration. There is no need any resuscitation. Here about 95 to 98% of the neonates. And these healthy normal neonates need only warmth, breastfeeding, close observation for early detection of problems, and protection from the infection and injuries. After cutting the umbilical cord aseptically, the baby should be kept dried, wrapped with a dry and warm cloth, examined thoroughly and quickly to assess the normal characteristics to detect the congenital anomalies. And next we have to do the identification tag tied to the mother and the baby. Here we have to write the not only the baby, we have to tie the mother also. Recording to be done accurately about the event of the birth, the baby, especially birth date, time, sex, examination findings, or presence of any problem in the delivery record sheet. And the next we have to move on the mother and the baby should transfer to ward usually after 1 hour of observation in the delivery room when the content. And the next one. The mother and the baby should transfer to ward usually after the 1 hour observation. Sick or risk neonates, we have they record the special care. I think you people know understand about the what are the care required for the babies. And the next we have to do the ABGA score. In ABGA score we know the appearance, respiration, reflex, pulse, skin color, everything we have to access. And then last class itself I taught you about the ABGA scoring. And then next we have to provide warmth. Here the warmth is provided by keeping the baby dry with adequate clothing, and the baby should be kept with the side of the mother so that mother body temperature can keep the babies warm. Most of the mothers are keep the babies in the cradle, so we must avoid for that. We have to keep the baby keep near the baby mother, so it will help to maintain the proper body temperature, and then they feel warmth. And next, baby can be placed in the skin to skin contact with the mother, kangarooing, to maintain the temperature of the infant to facilitate the breastfeeding. And then bathing the first day should be avoided, prevent the hypothermia. So we have to avoid the bathing. So this picture shows how we have to provide the warmth and clothing the baby. I think now you are understand about the warmth. And the next we move on the breastfeeding. So it's very essential for the baby's growth. The baby should be put mother breast within with half an hour to 1 hour after the soon as possible. The mother has recovered from the exertion from labor. Colostrum feeding must be offered the baby. Mother should inform me about the importance and techniques of breastfeeding. We have to teach about what are the texts we have to follow while we giving the breastfeeding. Proper latching methods we have to teach, and then demand feeding should be encouraged. Exclusive breastfeeding procedure should be explained to the mother and the family members. So here we have to, when the baby is required, they have to provide the exclusive breastfeeding for the babies. Every 2 hours once we have to provide the breastfeeding. These are the things we have to teach about the mother and their family members. It helps to enhance their breastfeeding. So next the picture shows how do we have to keep the babies. So next, skin and the baby bath. The baby must be cleaned of blood, mucus and the meconium. And the vigorous attempts should be made to remove the vernicaceosa. It should be provide protections of the delicate skin. So as we know about the Totisme vernicaceosa, it's a CC like appearance over the skin. It will help to protect the baby's skin. And the next, baby bath can be given the hospital using the warm water with warm room gently and quickly. Bath should be avoided at the open place. We have to provide the closed area. During winter months, the baby should be have the sponge bath rather than the deep bath. Avoid the hypothermia. So here, when summer, we can prefer the bath. During the winter time we must avoid the baby bathing. So the picture is showing the vernicaceosa which is present in the baby skin. It protects against the water absorption of the skin. So next we move on the Use of olive oil and coconut oil can be allowed for the 3 to 4 weeks of life. Oil massage improves circulations and the muscle tone. And the next, oil massage should be given before the birth. We have to provide the oil massage before giving birth to the baby. Exposure to the morning sunrise is important source of the vitamin D and the warmth of the baby. The talcum powder should be applied over the axilla, groins and then buttocks. So here we can apply the talcum powder over the axilla and then groin and then buttocks we can provide. And the next, care of the umbilical cord. Here the care about the umbilical cord is cut about 2 to 3 inches from the navel with the aseptic precaution during the delivery and tied the cotton thread and disposable plastic clip. The cord must be inspected for bleeding afterwards with the common occurs due to the shrinkage of cord, loosening the ligature. No dressing should be applied over the cord, should be kept open and dry. We should not do any dressing over the area. Normally it fall within the 5 to 10 days. Application of triple tie junctions violets is not advocated as the routine anymore. So I think you are understand about the care of umbilical. So we are cutting the 2 to 3 centimeter above the umbilicus. So next, care of eyes. Eyes should be clean at the birth and once every day using sterile cotton swab soaked in the sterile water. Each eye should be cleaned using a separate swab. Application of cordial in the eyes must be avoided. This to prevent the infection and lead poisoning. So we should not apply the cordial over the eyes. And the next, the eye should be absorbed the redness, discharge and then excessive tearing for early detections problem the prompt management. So we have to examine the eyes whether they having any excessive tearing or any discharge from their eyes, and then we have to observe the color of the eyes, and these are the things we have to detect. If it is any presence, then we have to consult about the pediatrician. So next, about the clothing of the baby. Here the clothing we should not use the tight dress. We have to choose the dress loose and soft and cotton cloths. Large button synthetic frock and then plastic nylon napkin should be avoided. A triangular shaped soft absorbent and cloth should be used, and the napkin, the cloth should be tight especially around the neck and abdomen. In winter, woolen clothing should be used. Here I think you people are understand about the clothing of the baby. And next we move on the care about general care. Here the newborn should be kept with the mother for continual roaming in. Whereas here I wish to say what is, we have keep the baby near the mother, that is the roaming in. And there is no separation between the mother and the baby. So we are keeping the well ventilated room. Baby should handle with a gentle approach after the hand washing. No infected person should be take care of the baby or touch the baby. Baby should be allowed the sleep and supine position. General cleanliness is to be maintained and the surrounding up to kept clean. Wet nappy should be change immediately. If the baby is wet their napkin, we have to change it then and there. So these are the general care including. And the next we move on the. So next, observation. Here the observation, the baby should be thoroughly observed twice daily for a daily detection for any abnormalities. Here we are observing about the temperature, pulse, respiration, feeding behavior, stool, urine and sleep pattern should be assessed. Mouth, eyes, cord and the skin should be looked for any infections. So we have to, during the exam, we have to observe the baby any early detection or any congenital abnormalities we have to observe. In vitals and thorough monitoring, here we are including the whether the baby having the hypothermia. We have to check the normal pulse rate and then access the stool and urine pattern. These are the things we have to observe, and then we have to check about the infections also. And next, weight recording. So about weight recording, assess daily weight gain in healthy term babies, which is about 30 grams per day. The baby weight is increasing around 30 grams per day. So we have to assess. Most infants double at their 4 to 5 months of the age. First weeks of life, there is a physiological loss of the body weight because of removal of the vernix mucus and then blood passage meconium and reduction of extracellular blood volume. Also due to the adaptation of new environments, the babies may reduce their weight at few days after their delivery. And the next, with adequate breastfeeding, majority of the babies regain the birth weight. About 7 to 10 days they regain their weight. So these are about the weight recording. So the babies double at their birth weight at their 5 months. triple at their birth weight at their 1 year of age. I think people understand about the weight recording. So here we are keeping the baby in the weighing machine, and we are checking with the, we have to, before checking the weight, we have to undress the baby to help to measure the accurate weight of the babies. I think people understand about the weight recording. And next we move on the what the immunization is very important. Within the first week of life, we need to administer about the immunizations to help to prevent the 6 killer diseases. So the mother should be informed about the national immunization schedule, and an explanation should be given about the importance and completion of the immunization and as possible reaction following the vaccines. The institutional deliveries, all units should be kept the immunized with the BCG vaccines and then 0 polio dose. We are administering in the hospital itself, and in outside or home deliveries, BCG and OCB also we should be given within the. And the next follow-up and advices, and each infant should be followed up at least once every month of the first 3 months of, and subsequently, and 3 months interval till 1 year of age. Follow-up is necessary for assessment of the growth and development, early detection and management of health problem. Health education should be given regarding the exclusive breastfeeding, warmth, hygiene, rooming in, clothing, immunization and follow-up. Harmful cultural practice should be discouraged. Care of home should be discussed about the demonstrate about the mother and the family. So we should not include the cultural practice for the babies. It should be discouraged. And then care should be the care required for the baby, we have to advise the mother, and then we have to, periodically we have to consult the doctors to help to detect the early detection and management of the health problems. These are about the follow-up. Hope you all understand about the newborn care. See you in next video.